Good evening, everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, which is prostate cancer. Prostate cancer occurs in the prostate gland, which is located just below the bladder in males and surrounds the top portion of the tube that drains urine from the bladder. Prostate cancer is the most common cancer in men after skin cancer. It grows very slowly, and the chance of getting prostate cancer goes up as a man gets older. To throw more light on the subject and can guide us on further diagnosis treatment of prostate cancer today, we have with us renowned urologist Dr. Rahul Yadav from Lucknow. Dr. Rahul Yadav, MBBS, MS, MCH Urology, is the director at Max Super Specialty Hospital in Gomti, Nagar, Lucknow. Dr. Rahul has rich experience in the field of urology, and his expertise lies in andrology, kidney transplant, and robotic uro-oncology. Let's hear more on prostate cancer today from Dr. Rahul Yadav. First of all, welcome, doctor, to today's platform. And our first question for you is, what is prostate gland?
Thank you so much for inviting me here. See, prostate gland is a kind of an organ which sits behind the bladder. It surrounds the urethra. So it is a gland which is there only in males. And after a certain age, it increases in size, which leads to problem in some patients down the line.
Right. So, is this cancer caused by genetic factors?
Yes, I mean, there are so many factors. See, the common factors are usually the smoking and bad habits. Plus,
Mm,
there are some genetic causes as well, some kind of mutations, which may cause these cancers to develop at certain point in life. Apart from this, I mean, even a male having a family history of breast carcinoma in the family, some kind of ovarian carcinomas, they are also linked with the same kind of mutation. So that can also be transmitted leading to these kind of cancers.
right, right. And doctor, what are the common symptoms of prostate cancer? How does one know in the initial stage that he is having prostate cancer?
See, usually in initial stages, it is usually asymptomatic. I mean, so very early stages can be asymptomatic. Plus, the patient can develop varied symptoms like problem in urination, problem in flow of urine. I mean, the urine streams break intermittently, or there may be urgency. Patient needs to rush to the washroom to pass urine, or there may be blood in urine. In advanced stages, I mean, the symptoms may progress to even obstruction of urine leading to retention.
So speaking about prostate cancer, when does it grow so much? When the person is mostly casual about it, or the person is neglecting it, maybe then?
Yeah, see, it's a very, very important question. I mean, good that you have raised it. See,
Right.
after a certain age, after 40 years, the
Hmm.
prostate gland is going to enlarge, but the rate
Right.
of growth of enlargement varies between patient to patient.
Hmm.
And so after 40 or at best after 50, one should have few evaluations like a physical examination with a urologist, a symptom evaluation with a urologist, plus a
Hmm.
blood test which is known as a prostate specific antigen, an ultrasound, and a uroflowmetry. All these things can detect early stages of cancer.
Right. Right. So, we always suggest our viewers, all the patients who mostly stay connected with us, that a routine checkup once a year is very much important. You should always keep a track on your health or the changes which are happening in your body. Doctor, what are, we just came to know about the symptoms of cancer, but what are the treatment options which are currently available for prostate cancer?
See, prostate cancer treatment depends on the stage of the cancer. Stage
Hmm.
one, we call it as a localized cancer, means the cancer is there within the prostate gland. Then
Hmm.
there comes a stage two. Stage two means the cancer has gone little beyond the prostate, meaning extra prostatic, meaning to the bladder, to the rectum. The third one is the prostate has gone to nearby lymph nodes. This is the stage three cancer, and stage four is the cancer is throughout the body. It may be in bones, it may be liver, it may be somewhere else. So depending upon the stage of the cancer, the treatment being decided by a urologist. If the if it is a localized cancer, means located just to the prostate, there are two very good options available, meaning a surgery, robotic prostatectomy, in which with the help of a robot, we remove the prostate gland, or a radiotherapy is also possible. When the stage has gone little beyond the prostate, there are options, similar options, but patient needs to take few more therapies because the cancer has gone little bit beyond the prostate. When it is
Hmm.
to a third stage, he will need a surgery or a radiotherapy plus two other modalities of treatment, which are a hormonal treatment. And once it has gone beyond prostate, nearby organs to all over the body, then a chemotherapy plus some form of radiotherapy for pain palliation, symptomatic treatment is required.
Right. Doctor, we are talking about, yes, please.
So it
So,
all depends on stage of a cancer.
right, right. We are talking about cancer here. It's something very serious we are talking about today. So, doctor, what other organs can it also hamper if the person is having prostate cancer? What are the risk factors?
See, cancer has to grow big, as simple as that.
Right, right.
Either somebody needs to check it, I mean, keep it on check, or
Mm,
somebody needs to remove it. If it is a
mm,
removable cancer by a surgery or by any other means, then obviously it is always a good and a better option. But many times it is not possible. I mean, the cancer has grown beyond the stage of cure, like it has involved the organs behind rectum, lymph nodes, multiple bones. So whatever one can do, they can't remove all these cancers throughout the body. So when the cancer has gone beyond a certain stage where cure is not possible, it becomes a place of worry, basically.
right. Doctor, let's talk about preventions also. What are the prevention strategies which one can take in order to, save themselves from prostate cancer?
See, I mean, it's a very old saying that healthy habits are always beneficial. I mean,
Right.
see, they protect in some way or another to the common disease which is prevailing in the society, as like
Mm,
diabetes, hypertension, or even some forms of cancer as well. Like
mm,
smoking is one really bad thing, I mean, which potentiates many cancers. So first of all, please quit smoking. Please quit any tobacco, any kind of tobacco chewing or any kind of tobacco intake. This is a very, very important advice. Alcohol usually doesn't cause, but yes, obviously, I mean, avoiding it is always an healthy habit. So we usually prescribe this. Plus a healthy lifestyle in the form of eating habits. I mean,
mm,
see, good food, healthy food is always beneficial. Plus, 30 to 45 minutes of exercise throughout the day is very, very beneficial. It
mm.
releases some hormones, it decreases some amount of whatever chemicals are being generated, which can promote all these things. So, a healthy lifestyle in all these forms is beneficial. And the most important part is a routine health checkup.
Right. Doctor, speaking about food habits, any food habits which can trigger the cancer?
Really not. As far as we are talking about prostate cancer, really not.
Right, right. Moving ahead, doctor, with the next question, which is what are the chances of relapse?
See, relapse all depends on, I mean, the stage which the patient came in. If it is a
Hmm,
stage one cancer which is localized, it's being cured by either surgery or radiotherapy, the chances of relapse are almost negligible. If it has gone beyond a certain stage, when the cure is not possible, then the chances of relapses are always there. But yes, for any cancer, whether we remove the entire prostate, we usually tell all our patients that they need a yearly or a 6 monthly follow-up. Once we are sure that after 5, 7 years of follow-up, the cancer has not come back, then and then only we say that this you are being cured of cancer.
Right, right. Also, doctor, we are talking about prostate cancer today, so we also need to know what are the things which can cause cancer. Let's talk about water here, water intake. If you talk about hydration here, how important is it? And people suffering from prostate issues or prostate cancer, what is the amount of hydration which you suggest?
See, either a dehydration or a normal fluid intake or an excessive fluid intake has
Hmm.
not ever been linked to prostate cancer. But yes,
Okay.
there is no cause and effect relationship. Cause and effect relationship meaning if somebody is taking less amount of water or somebody is taking excessive amount of water, doesn't cause a cancer.
Hmm.
Fine. But yes, a normal fluid intake one has to take, I mean, for his daily routine and everything. So the normal amount of fluid intake, 2.5 liters of urine in winters and maybe 2.5 and 3 liters or 3 liters of urine in summers is okay, pretty okay.
Right. Doctor, what about diabetic patients? How does this scenario look for a diabetic patient?
Diabetes as such is not associated with prostate cancer directly. I mean, there is no. So see, diabetes and hypertension are a lifestyle diseases. Many of the patients in the community are suffering from diabetes and hypertension. But yes,
Right,
increasing in incidences of diabetes and hypertension doesn't increase the incidence of prostate cancer.
right, right. Well, initially, today, before today's session, before we started today's session, did mention that we are lacking a short of time. Also, doctor, thank you for joining us at such short notice. It was definitely a very warm evening with you today discussing about prostate cancer. We had a lot of questions, but then as time is a constraint here, before we take a leave today, doctor, um, what can be the take home advice for our viewers who has watched us so far?
See, the best I mean one can do for his health is after a certain age, after an age of 40 to 50 years of age, get a routine health checkup, not only for the prostate, but so many
Hmm.
issues which are currently going in the society, like problems of heart, cancers, different type of cancers, even a prostate cancer. So after 40 to 50 years of age, for prostate cancer, at least come to a urologist, get a physical examination, get an evaluation whether you are having a symptom of prostate cancer or not. Few blood tests, an ultrasound, and a urine flow test that will suffice to pick up early stages of cancer if somebody is having that.
Right. Well, thank you so much, Dr. Rahul Yadav. That was our expert advice for today. And we thank you so much, Doctor, for your valuable time. It has been a very, very informative session for our viewers today. And we look forward to such session in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our FB page and YouTube page, Bladder Wellness. We are also available on Twitter and Instagram. Thank you so much. Have a great evening. Stay safe and stay healthy.
Thank you so much. Thank you.